blood glucose levels by scanning puncture. The purpose of this video is to teach people how to monitor blood glucose levels for people who are at risk for hyper and hypoglycemia.
Show you how to calibrate your glucometer. First, you want to start out with a test strip. I'm going to take one out. What we're going to do is we're going to insert the test strip into the meter. Okay? The meter's on now. What we're going to do, we're going to take this solution here. This is normal glucose control solution, and we're going to drop it right on that meter test strip. And this is going to tell you where your glucometer is reading. Okay, so the glucometer is reading at 101, and the normal should be between 70 and 100, so it's reading 1.5. So this tells you where or how accurate your glucometer reading is going to be. The only things you're going to need are these right here. These are your lancets. You're going to need those. Those are what's going to poke your hand and, get the blood. And then you're going to need alcohol to clean the area. You're going to need gauze just in case, somebody's bleeding and then you need your test strips. And you also need your glucometer. And then when you're done, you need a Band-Aid.
Okay. First things first, we always must wash our hands. It's very important to wash our hands to prevent the spread of microorganisms. Remember to wash your hands for at least 15 seconds. The best way to do it is to sing happy birthday or do your ABCs. You want to create lots of friction, get those bubbles going, and you want to remember to wash your wrists. And if you have any rings, remember to move the rings aside and wash beneath the rings. Rub your fingers against the palms, in between the fingers, and don't forget those thumbs. When you're done, grab paper towel, but remember to leave the water running until you have a fresh paper towel. Don't touch that. You are puncturing the skin. You are opening up the skin to the outside world. There are microbes on your hands. We want to wash your hands beforehand. It's always important to knock on the door before you enter someone's room. I'm going to shut the door for privacy. I'm going to introduce myself and my patient. I'm going to be taking care of you today. We're going to be testing your blood glucose levels. First thing we need to do is get take your blood glucose level. First thing we're going to do is make sure that you are Miss Jones. What is your birthday?
5/24/89.
All right. What is your first name?
Loretta.
Okay. And where are we at right now?
We're at the hospital.
Okay, great. All right, well, this is Loretta Jones, and we checked her chart earlier, so she is due for her blood glucose monitoring. First things first, we need to always remember gloves. Just standard precaution. We're going to put on our gloves.
You just wash your hands, right?
I sure did, Ms. Jones. Thank you for asking. And you as well wash your hands? Yes, I did. Okay, thank you. Okay, so which finger would you like to get your blood glucose test? Right here?
Yeah.
Okay, right now I'm just going to check the skin just to make sure there's no bruising, no open areas, and it actually looks good. So we test the finger. What we're going to do is we're going to take out our test strip. Now this machine is actually a little different. What we're going to do with this machine is actually install the test strip first and let that sit here. We're going to swab the area with an alcohol tab just to ensure that it's clean. We're going to want to do that for about 15 seconds. We'll let this area dry completely. We're going to take our lancet. We're going to break off with safety. We're going to push up on the skin a little bit and try to draw the blood up. When the patient washed her hands, she actually promoted vasodilation that helps. We're going to hold the skin. We're going to firmly press, do a quick pinch, and we have our test. Now this monitor is actually really good. It doesn't need too much blood, but we want a little bit. Some people are on blood thinners, anticoagulants, and have different bleeding disorders. That's something you need to consider. just want to wick up the blood. Okay. Right now, the meter is telling us a countdown, so it's working. Miss Jones' blood sugar is actually 83. Miss Jones' blood sugar is 83, which is within normal limits. We're going to give her a Band-Aid. It's always good to have gauze because sometimes people bleed profusely. You may need more than just a little Band-Aid. So we'll put the Band-Aid on here.
What happens if my sugar goes too low?
If your sugar goes too low, it's good to drink orange juice or something with a lot of sugar in it. Right, exactly. Test blood sugar 15 minutes after. Okay. We're going to dispose of the lancet in the sharps container. All right, Ms. Jones, is there any other questions I can answer for you?
No, I'm okay to eat.
Yes, you're fine. You can have your dinner.
Okay.
You do not require any insulin at this time.